Hello, my name is Sungti. This is my wife Nadia. We are both doctors. I'm a surgeon and she's a gynecologist completing her training. I come from Nagaland and we have been planning and working on a plan to build a hospital in Nagaland in the district of Mokokchung. The reason why you want to build a hospital, and growing up in a family where I had a brother who was physically handicapped and where there was a need of visiting a doctor every other day or every week or every month, my father instilled in me the burden to study medicine, and reluctantly I took up the subject because there was a need. And growing up in this region where there were a lot of medical needs, where services were poor, there was lack of specialists, and walking down the streets in the marketplace where people would approach you and say, if you're a doctor, if you have studied medicine, why aren't you coming back and serving your own people where there's so much of need, and why do you want to work in places where there are already a lot of other services? And this burdened us to come up with this project so that we can bring not the best, but at least something better than what they have in this region, so that the healthcare scenario could be improved. And that's also, while working on all these hospitals in India, I met my wife Nadia. I'm so happy that we are partnering together, and she can also say what she thinks about the idea that we have.
My name is Nadia, and I'm working as a gynecologist at the moment in the Inselspital in Ben. I was born and brought up in Nepal, in Pokhara. My parents, my mother is British, my dad is Swiss, and from a young age, I already experienced the poverty of third world countries, and it's left a memory in my mind of wanting to help and make a change in these societies where there's such a great need compared to what we have here in Switzerland. I did my schooling and my training as a doctor here in Switzerland, and that's also when I met my husband, and then together we decided that we wanted to do this project in Nagaland because, as he said, we were approached by several people in the streets asking us, or begging us even, to do something about the poor healthcare in the distant regions of Nagaland. And the people were very welcoming and are supporting us in this project, and now we're excited to start off.
Yeah,